Hey everyone, thanks so much for tuning in to Slice of Healthcare today. I'm your host, Jared Taylor. Joining me today is the president of Quantum Health, Shannon Skaggs. How are you today?
Good. Thanks for having me.
I'm excited to dive in. Your team has been very busy this year. It seems like you're in the news every couple of weeks for some new key partnership. Recently Sword, Paraloop, Progeny, and now Kindbody. Can you talk us through what these partnerships bring to the table?
Yeah. So for our journey through healthcare, right? So think 20-ish years ago, there weren't many benefit solutions like we have today. So there's a lot, and I think that's actually a really good thing. But what it adds is complexity to the system around us. It's really good for care. It's really good for innovation. What it's really hard for is a member that just thinks about the purple brochure they got during open enrollment on page 65 and tries to remember that they have solution 67. Again, back to we're human beings. We don't think that way. When we need something, we need it. And in healthcare, where there's a strange language where you don't even really know how to ask for what you're after or know even the question to ask. So with that backdrop, over the years, our 500 plus great clients have brought to us, as we start to install them, some have 5 benefit solutions with them. Some have 18, some have 20 plus. So what we've had to learn to do over the last 20 years, we currently work with 700 different benefit solutions. So we became very good at saying, okay, this one's in the MSK space, and it's very effective for the following personas, if you will. And how can we get this activated in a meaningful way? So in the early years, we didn't really talk much of that. We just did it. It was like bring your own point solutions is the way I would classify it. And if a client or a consultant asked, we were kind of Switzerland, if you will, around, who's doing a great job, what's the data you have. Well, after we started building this great data set, we started to notice there are others that are really doing a great job with integration, clinical outcomes, all of those kind of markers that we look at. So that made us form what we call our preferred partnership program. There are a lot of ecosystem partnership programs out there in the world. We have a bit of an opinion on the ones that are just there, have coffee, sign a rev share agreement, and off you go. That's not what this program is. This is how we think about it is we think how clinically focused and what are the clinical outcomes of this partner. What is the ROI that they bring that's validated, not only from the marketing materials from our partners, but a third-party actuarial validation. The experience is the third thing we think about. Think about NPS. Is this a great experience that people are going to be delighted by? Then we think of the more technical things. Technical meaning the scale of the organization. Is this more than a couple of guys and gals in a garage? Is this scalable? Does it meet security requirements? And then the last is roadmap. We think about how innovative and how dynamic is this solution. So that's the vetting criteria. Once we go through that, we actually look at a bunch of data. We make sure our experiences are good. Then we start to release classes like you've seen in the news around MSK, or a class like we're talking about today around family planning. There's a lot of great solutions out there that don't get the utilization that they deserve because they're just one of 16 things in the constellation of benefits. So when our navigation platform's in place, we know exactly when to activate them. And often activating those solutions with providers is the most effective way. Like I mentioned before, 50% of our interactions are with providers. If you say to a provider, hey, I'm getting that authorization on file for you, and did you know this member has this great benefit by the name of Kindbody that can really help support this member on the journey? Imagine what that activation looks like for that member when their provider has that on hand when they sit down in that consult room and have that conversation. So that's the preferred partnership, taking it from like 700 bring your own point solution to the ones that we think are doing a really great job. And then where we're going with that is there's a premier world that we think there could be around cancer, MSK, behavioral health, where we think employers would have to plug to a bunch of things together, where we could do an end-to-end solution there. So that's kind of like the the story of how we got to where we are and where we're going around our ecosystem partnerships and preferred partnerships and premier offerings.
Well, Shannon, thanks so much for joining me here today. Excited to hopefully have you come back on in the near future and we can dive into some more topics. But
Awesome. Thanks for having me.